This video is about the statement that I hear most often from my new patients, and that statement is, I hate the dentist. And I've decided to tackle this statement head on. If I had £1 for every time a patient told me this statement, I'd be a millionaire and I wouldn't be doing this video. I'd be on a beach in Barbados somewhere. Remember that statement is such a negative starting point for any relationship, especially one that you want to build trust with and work collaboratively with. If you were at a dinner party and you said, oh, I hate this particular profession, and that person was sat next to you, you're never going to have a decent relationship moving forward. So we need to remember this and figure out why it is you don't like dental treatment as opposed to why you hate the dentist. I think this is where this self-analysis is very important, and you have to truly understand your why, understand why you do not like dental treatment. This is where the workbook works very well, and it actually allows you to pinpoint exactly what your fears are, what your barriers are that you have to overcome in order to move forward and receive dental treatment. I have no doubt that some of you have had a bad experience with a dentist, and maybe that particular dentist you highly dislike. But it is important to remember that if you hate every dentist, you will never move forward and break the cycle of receiving regular dental care. The biggest thing you can do at home from your living room to find that right dentist and find that right fit for you is finding one with the right personality. And there's going to be lots of hints and clues that you can just get from your front room on your laptop. So it could be that you are looking online, looking at their website, looking at their general online presence, maybe reading some of the testimonials, video reviews. All of this that kind of stuff is going to help you understand whether that dentist is the right dentist for you. Once you have found that dentist that you feel you can move forward with, then it is important to work on this list of things that you find difficult to receive dental treatment. So this is the statement of, I hate the dentist because, and this is the list that you're writing, which may include some of those top 7 that we mentioned in the previous video, for instance, pain, needles, gagging, etc. And then you need to be able to express and convey to the dentist exactly what these problems are, and they can work out a strategy of how for you to move forward. It could be that you are fueling this kind of painful cycle of care because you only go to the dentist when you've got a problem, and it's only when that problem has got to a great level of intensity is when you try and receive care. And in those situations, it could be that there's so much inflammation, there's so much pain, the abscess is so big. That's why it's very difficult for you to receive pain-free care. So in those instances, it is important to get you in a situation where you are stable so you're able to receive electively pain-free care. A lot of patients mention the drill to me at this stage, and this is difficult because we do probably need to use it for some part of your dental care. But there are again ways which we can alleviate your stress or your fear using drills. For instance, we can show you what it feels like on your hand. We can get you used to the noises. We can allow you breaks, ensure that you are completely numb. And in some cases, we even use noise cancelling headphones. You can listen to your favourite music and not even be aware that the patient is having some drilling treatment done. Obviously, I can't miss out needles. Needle phobia is something that is so prevalent within society. Even I have one. I'm not good at the receiving end of an injection, but there are many ways we can deliver pain-free injections. We do have a video that's specifically dedicated to this, which shows the techniques that we use at Southport Road in order to deliver a pain-free injection, but please be aware that you are not alone with this phobia. Another issue that patients can have is that they actually have this feeling that they're going to be judged, that they're ashamed of their teeth, they're ashamed of what the dentist is going to say. Maybe they've been told off by a dentist before or felt they've been told off, and they don't know what is going to be said when they open their mouth and the dentist looks. Remember that we know that this is the starting point. We know you've got a fear, we know you've got a phobia because we've already discussed this and you've explained that to us. So we're expecting that there are going to be some issues that need managing, and we're going to move you forward to get you through those in order to receive your care. Unfortunately, fear and phobia is not simple, so often it is a complex mix of a few things that causes the patient not to be able to go and see the dentist. But if you can change that statement in your head from I hate the dentist to I dislike dental treatment because, you will leave that first appointment with solutions instead of another dentist biting the dust and never moving forward with your care.